So this kind of gives you an overview, and it's a very, very busy slide, but I think Dr. Eubanks, you and I, we talked about this in Vegas recently. The opportunity is endless. And the way that Antonio described the overall picture of Vydence to me, he said, we take all the pain points of all the different laser companies, we get their devices, we benefit them, we increase the benefits of them, we try to take away as many pain points as possible. So literally they can go head to head with any device that's out there. And the way that I think of Vydence, at least in my practice, it's the Lexus of lasers. So they've taken everything, they've taken the technology, they perfected it. They're still innovative, like with the ProDeep that we're going to talk about just shortly. And they've made it something that's very, very reliable. This is Dr. Eubanks. Dr. Eubanks, you want to tell us a little bit about yourself?
I am. Okay, sorry. I'm a dermatologist. I've been in practice, 40 years now, so forever. I'm the senior guy here by a long ways. But I've been in laser most of the time, was one of the early laser people in Colorado and expanded that, worked with multiple companies. And back 8 years ago now, my company, Advanced Dermatology, transferred me to Florida to do two things: run the laser part of their residency program and to be in charge of their laser company around the world, or around the country. And that's what I'm doing currently. But just a quick note, I know we're going to hear much more, but I've told people I rarely get excited about devices anymore. I've seen everything. And the Vydence products are unbelievably effective. I never would have believed it till I used them. I got like the first one in the US back in January, and I've done so many cases, and I just love it. And I'm looking forward to hearing everything about this tonight.
Stephen, what made you actually partner with Vydence for the first time?
It was a long interaction. My good friend Carter Morgan is vice president of sales for Vydence in the US, and he asked me if I would look at this. And of course, I ignored him completely at first. And then we talked again. And so I said, okay, you're my friend, I'll try this. And it took me probably a week to realize what I had in my hand. And so I've had, many of the hand pieces, and I do many different treatments with it. I've been lucky enough to go to Brazil and see the company and see how these incredible devices are put together. And I'm just a huge fan, and that's rare in my case, but I love it.
That's fantastic. And so I'm going to share my experience in just a second here. So my background, I trained in surgery first and then dermatology. I actually boarded in dermatology, not in plastics or general surgery. And then I did a Mohs micrographic fellowship, and then I did a laser fellowship. So kind of a roundabout way to be where we're at. To me, this is one of the most important slides that I put into any presentation. Anybody that I've had the opportunity to speak with before, work with before. I know, Tess, you're on this call. Who else do we have on here? We have, let's see, who else do we have? We got a bunch of people on here. And so, anybody that I've had the opportunity to work with, I always talk about who are the other companies that I get to do research for. And when Vydence came to me, it's very similar to what you experienced that you had, Stephen. It was Trent, who's in my backyard. And he called, he emailed 3 times, he called 4 times, got a hold of my wife. She's the practice administrator. And then on the 3rd time that I got the email, I was like, okay, this gentleman is so persistent, I have to be able to talk to him. And I always describe when I was in high school and college, that's how you date somebody. They don't really look at you that much, but you stay persistent, and eventually persistence beats resistance. So that's exactly how I got involved with Vydence. And when I got to meet with the group and the CEO as well as the CTO, Chief Technical Officer, what I discovered is just like I described, this is a lot of power inside these three platforms here. And you have so many opportunities that you can treat anything from as simple as hair removal. I don't say simple, but anything as common as hair removal to something more unique, like we're doing with scars and resurfacing with minimal downtime. So there's a lot that can be done. And normally when you have this many opportunities, I always describe it as it's a jack of all trades, master of none. And that's usually because you have one filter that you're going to put in that's supposed to do something different. You have another filter that you put in that does something different. The unique portion on here is these are all lasers. There is an IPL handpiece. If you look to the far right side, one row up, it'll say IPL SQ. The interesting part about this IPL, it's the only other continuous motion IPL that I've seen other than Cyton's Hero product. So that's something pretty unique. So you're able to fire in continuous motion. So you're putting lower fluids, but higher energy over an entire area. So I think that's pretty interesting. The two main platforms that we talk about, the Etherea MX platform. Stephen, have you used this platform at all?
Yes, I have. I have one of each of these platforms, and to me, they're almost identical. The difference is this is smaller, has a smaller footprint, so I can put it in one of my offices with less room. But 95% of the applications can be done with the smaller device. Just a few tiny things are different with the Zye as far as my practice is concerned. This was my first one.
This is your first one. And I know a big advantage of this particular device, especially if you're starting off a practice and you're renting space or subletting space, this runs on a 110 volt. So you don't need a 220 volt that's dedicated. You don't need to upgrade anything in the wall. This is the platform that Dr. Eubanks was just talking about. This is what we have in our office. It's a Zye platform. This is the Rolls Royce of everything that's out there. So any of the hand pieces can go on here. And if you look at this, what I'm going to share with you here, on one side, you have a particular wavelength, and on the other side, this is all interchangeable, so you can change out what you want to do. And so, pretty neat what can be done. It's interesting. I know one of the hand pieces, Dr. Eubanks, you and I talked about before, is why are we using something called an erbium YAG? So erb YAG, but this one actually has an erbium YAP, YAP. Can you tell us a little bit about the erbium YAP, which is also called a ProDeep?
Sure. This is actually my go-to handpiece. It's a brand new way that's not available anywhere in the world, actually, except on this device. And it's a 1340 non-ablative. Either I use two different tips to it. One is a collimated solid beam, and I use that for active acne. And then the fractional. There are two fractional hand pieces that I use for primarily scar revision, especially acne scar revisions, where I'm getting remarkable results.
That's exactly right. And, a lot of times when we talk about lasers, the basic thing that you have to talk about is what Rox Anderson and his partners had developed. It's selective photothermolysis. All that means is you're putting enough energy in just for whatever the chromophore, whatever's absorbing that light, to get heated up and destroy what you're trying to destroy. If it's a tattoo, we're trying to break up the tattoo pigment into smaller pieces that macrophages can come in. If it's hair removal, you're actually targeting the color inside the hair, so that way you can create enough heat that it destroys the hair and things like that. So that selective photothermolysis, this is something that you have to understand when you go into lasers. Here, I know, Dr. Eubanks, we talk often about ablative versus non-ablative, and you had mentioned how the 1340, the very unique wavelength that they have, is a non-ablative laser. And a 1340 nanometer, it's the only one that's very, very specific to water here. It actually gets a higher concentration of water. And then here's the ablative. So if you look on the left side of your screen right here, you can see it's taken off part of the skin. Whereas with the non-ablative, you're not disrupting the skin, but you can see the column of heat that's inside here. Any comments on this slide, Dr. Eubanks?
No, but I think it's important with one thing people don't realize with this platform is you do have the option of a fully fractionally or fully ablative erbium YAG that will do what's on the left here, or a non-ablative and a YAP ProDeep. if that's what you're desiring to treat. It gives it great flexibility.
And I was feeling bad when Trent parked the device here, and he's like, "Oh, let's use it for Pico and let's use it for the DualMode." And what I realized is the one that I grab multiple times a day, including earlier this afternoon, where I'm going to show you a video of somebody that we just treated this afternoon, is my ProDeep, because it's a non-ablative, minimal downtime. Typically, most people, they're going to have a little bit of redness for 30 minutes to maybe a few hours, but it's rare to have more than that. And again, both of these devices, whether it's ablative or non-ablative, the chromophore is going to be water. That's what's absorbing that wavelength of light, and it's heating it up. So what are the disadvantages of doing a non-ablative? Typically, it takes more treatment sessions. But again, there's minimal to no downtime, and you are still causing some of the disruption of that, the DEJ, the dermal epidermal junction. Anything you want to comment on this picture?
No, I think you've got that perfect.
So here's the device that Dr. Eubanks and I are talking about. It's called the ProDeep. This is the 1340. It's an erbium YAP, Y-A-P. And some of the common things that we treat on this on a regular basis, just like Stephen talked about, there's acne scars, active acne. We do some skin resurfacing. So that's fine lines and wrinkles. I'm going to show you a detail on that. And then hair growth. Anything else that we're missing on here, Stephen, that you use in your practice more often?
Well, I have started in the last 3 months to really look at active acne. It is, and I've got a lot of other devices, including some specialized, I won't mention which one, a specialized acne-only device that I found ProDeep, as simple as this little hand is more effective than any of my other dedicated acne treatments. And by the way, it takes about 5 minutes to treat a full face with it.
Which is pretty amazing, because I didn't believe it was going to be that fast. I said, that doesn't make any sense. I've had a 1510, 1550 nanometer, both are non-ablative. I have a 1450 from the 1550. It's a 1450, right? From the Frax 1450 from Cynosure. That's a great device as well. And we usually commonly use that on acne scars, especially in between treatments. Some of the other devices, like you have, Dr. Eubanks, I know you have, just for an educational purpose, I'll describe what I have. I have Aerolase. I've got my Cyton BBL. I've got, I don't have Aviclear, but I think you have experience with Aviclear. We have something called Advolite. So they all work for acne. And I was asking Dr. Eubanks, when you have these other devices, including Aviclear, why are you reaching for the Vydence technology first? And Dr. Eubanks, do you want to comment on what you shared with me in Vegas?
Well, there are two important reasons that I'm excited about ProDeep for acne. One, it's has minimal discomfort, and compared to, for instance, Aviclear, which I find to be extremely painful. As I said, it takes just a few minutes to do a procedure versus about 35 minutes with Aviclear and about 90 minutes with a cure. So time is of the essence here. But more than that, it's the efficacy. What I do is I do a quick pass over active lesions with that collimated handpiece, and then I do the whole area with the ProDeep. And it's so quick and, again, very minimal discomfort.
Yeah, and that's exactly right. And so there are two ways to look at it. One is going to be making sure we get better patient results. And why is that so important? Because it builds up what's my favorite 5-letter word in the office, trust. So once a patient sees the results, they're more willing to trust, either the man or woman that's in front of you is more willing to trust that you know what you're doing, and they're willing to be more compliant with their take-home medications. The other thing that I describe is safety. So there's 4 things that I ask every single person when you're looking at a device. And if I add anything in my practice, I ask these same 4 questions to myself. Number 1, what's the safety? We know with the 1340, if you look at this particular wavelength in here, it's a very highly effective wavelength. And what you're going to find is you have greater penetration as well as bulk heating. So that's the biggest difference between, let's say, a 1340, and I kept saying 1450. It's a 1540 Frax handpiece that I have from Cynosure Icon. So you can see it penetrates deeper, and it's much, much faster, but it's still safe. So it's safe. It's safe in all skin types. is it efficacious? And so that's where we're going to share with you some of the efficacy. Hold on one sec. I'm going to share. Okay, here's a couple of cases that we're going to share with you, but just to give you a preview, you can see how efficacious this is. And again, for a young teenager, Dr. Eubanks, you want to tell us about this patient?
Well, this is a young man who's getting ready to go up to college for his first year, and he was just devastated that and he was so afraid to think about going to college. And the picture I just took this week on the right, he looks better than the picture even looks, and he's just happy as he can be. And that's what makes a difference. These kids just, when you clear up their acne, they're really happy.
100%. And he came back for his other two treatments. And I think that's what I wanted to point out on this particular picture that you shared with us, is that he actually came back for the other two treatments. And for most guys, and maybe he's tougher than I am, I'm not tough. If something hurts, unless I see a very dramatic change, I'm not going to go back. Whereas some of the other devices that we have in our office, yes, they work and they work quite well, but are they as quick in terms of efficacy, or are they as painless as this particular device? So let me go back for one sec. So here's a patient that we typically treat. This is somebody that I see on a regular basis. She has all these static rhytids, and you can see we're just using this. This is in real time. I'm not speeding it up. I'm not slowing it down. We're going to treat over the upper lip. And this is the only area that she said that it was a little bit more spicy. And she said, if it works, I will do it again. But this was just from this afternoon. I was just shot on an iPhone. I put it together just to give you an idea how quick it is to treat somebody. I'm going to share a case. This is a 27-year-old gal. She comes in. She's getting married in 6 months. And so her mother is actually the patient. And she says, can you help my daughter? I know she's not going to ask about it, but it bothers me. And it bothers me because she says it bothers her, but she's not willing to invest time in it. So this is what we see. She got a gunshot, not she wasn't shot, but the recoil of the rifle smacked her in between the eyes, and it cut that open. Because she was in a remote location, she couldn't go get suturing or anything like that. This is what she looks like at the 3-month mark, and she's asked, can we do something to help? What she says really bothers her, it turns really, really red when she exercises or drinks any alcohol. So this is when we used a combination of ProDeep. It was 2 treatment sessions. And we're using, this was a test protocol for a product that we're getting from Korea. It's called polynucleotides. So the brand name is called Rejuran, Rejuran. And we're trying to see, can we use polynucleotides as scaffolding to put underneath there? So that way, when we do a ProDeep treatment, the macrophages that come in, they're more effective. The fibroblasts that are then growing collagen and elastin are more effective. So this is 1 month after 2 treatment sessions. And hopefully, if you can't tell, the one on the right is the after. She hasn't come back in for her 3rd treatment yet. What other options do we have? I know, Dr. Eubanks, you and I were talking about this earlier. This, to me, is frigging incredible. If we can use something that's so quick like this particular device and we can help regrow hair, I'm all in. So we got the little handpiece. We're in the early portions of doing a pilot study just to show what happens when we use this with Benev exosomes as well as a LED light. It's a red light that's a pulsed wave red light, and that's called a Smart Lux. So we put it all together along with Viviscal to see what kind of changes we're getting. And if you look on the bottom left, that's pretty typical for the types of changes we're getting. And we're seeing that within about 2 to 3 treatment sessions. No pain, very, very quick to do. And it has now become a quick add-on service. Any comments on hair, Dr. Eubank?
I am just beginning to do this. Most of my experience was talking to the Brazilian doctors who have been doing this for years, and every one of them swears by it. This is going to be a real game changer for us. And again, it's just the matter of adding it's a different tip to that ProDeep, and it's so amazing. You can do all these different things with one handpiece, of which there's 7 others you can do.
Right. And these little tips, they're magnetized, they just pop on and off. And as soon as you put a new tip on, the platform itself automatically recognizes what's there, and it gives you guidance in terms on the GUI, the graphic user interface. It gives you guidance on what settings to use. In addition, from the companies sharing some settings. So we're just using very on-label type settings, and we're getting good results so far. So one of the questions that one of the patients asked me is, what kind of results can we expect for hair growth? I know, Dr. Eubanks, you said you're just starting with this. Do you have any comments on this question?
Well, again, based primarily on Brazil, they're seeing this tremendous photographic evidence of hair growth. Don't know how long does it last? It's like any other treatment. It appears to be long-lasting in these patients. Unfortunately, I'm not sure we know the mechanism of action. I believe that it's increasing vascularity to the hair follicle. An important thing about the way ProDeep works for hair, though, is that it's one of the few wavelengths that doesn't actually break the hair or damage the follicle. Almost every other wavelength has hair damage involved with it. And for some reason, they found themselves a wavelength. And unexpectedly, it is perfectly safe to the hair. So if you're either doing other hair like transplants or something, you're not damaging the hairs, which is really important.
And if we ever get invited back, I'll share what our protocol is going to be right now, the way that we're utilizing this. And we're a little over 2 months in, or second session in. We're utilizing, so we use the ProDeep first. Again, just like Dr. Eubanks talked about, the theoretical mechanism, it's increasing vascularity both temporarily as well as long-term. Long-term, we're going to see when we use multiple treatments of the ProDeep, you get neovascularization in that area. When you have neovascularization, you're going to have more blood flow, more nutrients to that area. When you have increased blood flow, you're also going to remove any of the cellular debris that accumulates just by having enough birthdays. So whether we're in our 30s, 40s, 50s, 60s, we should be able to improve almost all hair growth. I'm also using this now as a drug delivery system. So rather than injecting PRP or doing something off-label like injecting exosomes or a PN polynucleotide, I don't need to do any of that. I actually use the ProDeep first. I topically apply, for me, I'm using right now the Benev ERC Plus exosomes, just because there's some hair studies that have been done with that showing that it works, but without having to use our RF microneedling device, which has a more pain as well as a tip consumable, or a dermapen, which is our skin pen, which is going to be having a tip as well as some pain involved with that. So I don't have to worry about, are we breaking the skin? Can we wash the scalp and everything like that? I apply this, and then immediately afterwards, I put them under that pulsed red light that's called Smart Lux. And so they sit under that light for 10 minutes. They come back at the 2-week mark. They sit under that same light for 20 minutes. Their at-home homework is using a hair supplement. Right now, we're testing the Viviscal Pro just because it has the most research that's out there compared to other hair supplements right now. And that might change because, again, if there's a company that shows better research, we're going to go with that company. Dr. Eubanks, you and I know we talked about this earlier. We are brand agnostic. We don't care what the name brand is on there. It's what's the best for our patients.
Yep, absolutely.
And the 4-week mark to 5-week mark, they're going to come back and do a second session. So it typically takes 3 to 5 sessions. What other options? Well, Dr. Eubanks, you want to touch on why there's a mechanism of action for both nodular as well as papular acne?
Well, and again, I think that this is unclear because I've talked to the scientists. They've had various things. There is some evidence that certain growth factors and possibly transforming growth factor beta may be increased with this laser, which might explain some of the results with acne. It is not just destruction of the sebaceous gland, like Aviclar and a cure. It's a different mechanism.
And most times what we see is, sorry, I missed the last part, Dr. Eubanks.
I'm sorry. I believe it's immunologic more than it is destructive.
Right. Yeah. And I think there's typically, at least in my opinion, and Dr. Eubanks, you correct me if I'm wrong, there's there's literally three major mechanisms and maybe even four for acne formation. One can be hormonal. So if there's an increase in testosterone, we know that turns on the sebaceous gland. The sebaceous gland, as it starts producing more oil, it can block up the follicular ostia. That's the follicular opening, or what we call a pore. So if there's a blockage there, then what ends up happening is now you have a nice moist environment. There's more sebum that's still being collected underneath the skin. And with the more warm environment, the natural Propionibacterium acnes, which is now it's called Cutibacterium acnes, it's already sitting there and it can propagate inside that warm, moist environment where there's a blockage of the follicular ostia. When there's propagation of that acne bacteria, that leads to some more inflammatory components that come inside, and that can lead to either red bump, or if it's enough, it causes a little pustule, or if it's even more so, then it causes a nodule or a cyst. And so with this particular device, you already heard Dr. Eubanks's commentary on it. I think it's doing a multitude of things. One, the heat alone is probably going to destroy some of that acne. If it's going to disrupt and create enough heat that it can cause a temporary change in the transepidermal water loss, or even open up the follicular ostia, there's a chance of that improving. And probably with the heat related thing, because the depth that we know that the 1340 goes to, it is affecting some of the sebaceous gland as well. And like Dr. Eubanks so elucidated, there's probably an immunological component as well. So there's a lot of theoretical opportunities, but what we know and what the patient knows, it works. And that's where we're seeing that there's an improvement here. So this is a theoretical mechanism here. And we shared this slide with for Dr. Eubanks. Do you want to tell us about this patient, Dr. Eubanks?
So this is an interesting patient. This gentleman has had almost everything. He was on Accutane 3 times. Wow. He did Everclear 3 times and came back looking like he did on the left side of this. And after just 3 treatments, of which, by the way, he just is ecstatic because, number one, it didn't hurt. After what you said about patients not coming back, he was very reluctant to let me try a laser on him after our Everclear experience. But he's just clearing up where nothing else worked. And to be honest, I can't fully explain this. I see the results.
And I love this. When I saw this picture, Dr. Eubanks sent this picture to us yesterday, I was like, look, on the first one, he's still trying to kind of look away from the camera. On the second one, he squares himself off. So you can see typically in a confidence level of a patient coming through. And I always describe it, when somebody has real bad acne, they kind of keep their head down as they walk through the clinic. And as it clears up, they're like high-fiving our nurses. They feel like they're coming through an NBA finals. It's pretty amazing. How about here, Dr. Eubanks?
This was primarily some severe scarring. This is a person I'd done 4 or 5 treatments with RF microneedling, and he just wasn't getting anywhere. And it's a little hard to take pictures of scarring, but this is, I will probably do 3 or 4 or 5 more treatments on him to even get better. But these big scars, the angle of the jaw there, have really flattened out, and the atrophic ones up on his cheek are filling in. So this has been, to me, since he's done so many other things without success, it's not perfect, but it's way better.
Well, and the other thing that I noticed on this particular photograph is you can see on the left-hand side, the width of that scar where there's no hair that's growing in because it's scar tissue. It looks like you're starting to normalize some of the collagen production underneath there. So if that removes some of those scar bundles and creates more of that basket weave collagen that we always describe, it should allow more of that hair to grow into those scar areas.
It's really improving.
How about here?
This was just a young lady who had a scar on her forehead. And again, the pictures, the one on the right is a little more in focus. But in person, she didn't have third treatment. She came in and she said, gosh, I think this looks so good. I don't need another treatment.
I love it.
So you can do little scars. You can do big scars,
One of the questions that I get asked often, especially at conferences and things like that, for something like this, what would you charge a patient in general in Florida?
Yeah, for a treatment like this, it charge about $100 for a
it takes how much time?
For a full face, you're looking at, probably 400, 450, somewhere in that ballpark. But remember, this took me 10 seconds.
Exactly. Exactly. It takes us longer to either move the patient into the laser room or to bring the laser in and fire it up. That's why.
Far. And yeah.
Here's another example.
Can I add something before we move forward?
Course,
Sorry,
please.
Dr. Chilukuri. Can I add something before we move forward? On this part right here, it took you very little time, but then also no consumables. So that's also something huge with Vydence, is that we have no consumables on any of the hand pieces that we have as well.
And even here, you're going from using the Virtue, what's the cost for a needle tip on the Virtue? Like $70, $2?
About $80, I think. Yeah.
So that's pretty standard.
So it's amazingly economical. And this was part of Vydence's philosophy, make an incredibly effective product, but keep the cost very reasonable. And I think it partly is because the Brazilian market is more interested, and they really hate disposables there. And so it all worked out for us.
Me too. I hate disposables as well. And that's as a business owner, I'm always looking at, can I get the same result or even better with less cost to me every single day? So that's a huge part of why we're pulling this device out on a regular basis rather than going to one of the microneedling devices or RF microneedling devices. There's no consumable here. It's also, I think you were talking, Dr. Eubanks, about utilizing this for hidradenitis suppurativa.
Yeah, I've only just started. I've got a couple patients. It's, this is one that was almost beyond my belief when I saw these slides in this paper when it came out. But the thing that, even more than looking at the clinical pictures, because they're, what I think is impressive is the lack of inflammation after these treatments. You'll still see scars. You're not going to totally remodel scars like this, but if you can reduce that inflammation, which is what we're seeing in the upper pictures.
On the histology. And then if you look at the right side, the very bottom right photo of the buttock where there's some PIH, post-inflammatory hyperpigmentation, you can go back and we can use the Pico handpiece that's also on this device and improve some of that pigmentation. So there's lots that can be done. I do want to point out, this was actually published in 2015. So even though Vydence is something that's relatively new to the American market, this has been in the Brazilian market for over a decade and a half. So there's a lot of research that's behind here. So I'm glad they got to experiment with it first, because they're giving us guidelines in terms of what settings we can utilize here. Dr. Eubank, do you play with the DualMode device as well?
I do for certain things. My practice is a lot like yours. I have so many toys to play with that it's been hard for me to utilize every handpiece that Vydence has on this thing. A couple of my favorite ones that I use the True Lift around the eyes. I find that to be a great. It's one of these real time-consuming procedures. It takes about 30 seconds to treat under the eyes, and patients, don't. I even did one of the VPs, a man, which is always a tough market, without numbing or without cooling, without anything, and he was fine. I've done a lot of True Lift. I'm starting to like that for under eye bags and wrinkles.
So we're going to share that with you in just a second here. But with the DualMode, you have lots of different opportunities. You can use a microsecond, a millisecond, you can do smooth pulse. And the way that I describe this, if anybody's ever used a Halo, which is a great device, this is a little bit different than a Halo. It's not a hybrid system in terms of using two wavelengths. It's using the 2940 erbium YAG, but in a different mechanism. So you can change the pulse duration and, of course, the frequency. These are all the 6 different tips that are going to be available in the US. Right now, there's 5 tips. The one on the far right, the one that Dr. Eubanks is talking about, the True Lift, that's not here yet. It's FDA pending, which means hopefully in this third quarter, it's going to be coming out later this third quarter, or maybe the beginning of the fourth quarter. So I can't wait to play with it. And again, these are magnetized. They just jump on the handpiece and you have automatic recognition. So there's a lot that can be done. In terms of why we choose certain handpieces, you can use a 2.5 or a 6 millimeter collimated handpiece to treat superficial lesions. If you're trying to tighten the skin and cause some vaporization of the skin, you can use the 8 millimeter handpiece and really get some nice changes with scars. And I can't wait to get to use this TrueLift. So I'm really, really excited, Dr. Eubanks, after you shared your experience recently in Vegas. And so I've got now, I think 8 or 9 patients already signed up since I saw you last. They're just waiting for the handpiece to come in from Brazil. And once it's FDA cleared, I'll start putting these patients on, and we're going to treat them complimentary just to see what it does. In terms of the GUI, the graphic user interface, it's very, very simple. It gives you an idea. If you look on the top right of the screen, that shows you what handpiece is on there. It automatically recognizes it. You can change, of course, the fluence, the pulse time, and how quickly that you're going to fire. And then if you look on the bottom portion here, bottom central, you can see there's a single mode as well as a dual mode in the second piece here. And with the dual mode, you can change how much you're using for a coagulative effect as well as ablative effect. So it gives you kind of a little bit more oomph. So I don't say it's like a CO2, but it's pretty darn close to being able to do the ablative portion of a CO2, excuse me, the coagulative portion of a CO2 while you're doing the ablative portion of either an erbium YAG or a CO2. This is a case that I want to share. This is a 47-year-old woman. She comes to see me. She's actually my wife's friend for now. Our oldest is 16 years because the kids were born about a month apart, her son and my daughter. And she had a surfing accident a year ago while she was in England and had terrible surgery, lots of pain. And what she commented on when she came recently, I said, "Oh, how's your leg doing?" "Oh, it's okay. You know, I've given up. I'm not going to be able to wear shorts anymore." I said, "Really? Why not?" She goes, "Well, look at it." And she pulls up her pants, and this is what I see. I said, "Do you mind if I try something? We have a new device. Let's see if it does anything." So this is a year later. You can see this erythematous portion. The bottom half of the scar is hypertrophic. The top half, you can see there's some good healing, but there's these track marks. I'm going to share with you now the after. This is after a single treatment. I used a ProDeep single pass at a 60 joules. And the second pass I did with was a single pass of the dual. And then we applied on half the scar. We did a topical Rejuron, which is the polynucleotide. On the bottom half, because it's hypertrophic, we're doing a split scar study, a pilot study. And we put a little injectable in there, a total of 0.2 cc's. And look, this is 1 month later. She is ecstatic. She actually feels like there's light at the end of the tunnel. And she goes, "It was fine. It didn't hurt that much. Come back in. I'll come back in and do it again." So she's coming in later. I think she's supposed to come in this Friday as long as the weather permits.
Dr. Chilukuri, I was with you when you did this treatment, and oh, wow. I am like, these
Pretty neat, right?
are amazing. Yeah.
So this is a single treatment session.
That's
so
amazing.
What else can we
Great
do?
Results.
Pretty neat, right? And
yeah.
So if we have the same patient right here, you can see there's some hyperpigmentation. If she wasn't part of our pilot program, the second treatment I would do is I would actually start with the Pico, handPICO. On that same day, I'm going to do the ProDeep, and then I'm going to do my dual. So why? Each handpiece is going to have a little bit different efficacy. So with the handPICO, I want to go back here and I want to break up some of the pigment. So that way, as the pigment goes, we're using a photomechanical effect rather than a photothermal effect. I don't want hyperpigmentation. I just want to hit it so fast, it breaks up some of the pigment into smaller pieces for the macrophages. So Stephen, are you using this handPICO quite a bit?
I am. This is one of my, I don't use it as much as ProDeep, but I just love this. Part of it is when I was in Brazil, I was able to see the inside of this handpiece, and it's incredible how they packaged it. And one of the things I really like about this, it does a couple of things. One, it can do picosecond, certainly the only handPICO, but with a push of the button on that screen, you can change it to nanosecond. For instance, treating tattoos, I actually prefer nanosecond. For treating pigmented lesions, I prefer picosecond. But at the touch of a button, you can change it. It's really a cool handpiece, and it does have both so 532 and 1064. Another thing, people, I hear from a lot of companies, oh, my standalone $250,000 Pico laser is so much more powerful. But I've just been doing a little study on the actual deliverable energy, and this is very close to all of the deliverable energies of all the big machines in a single handpiece.
And that's the best part, is it's in the handpiece. You don't have to buy another device. That was so unique to me. And one of the things Dr. Eubanks talked about just now is, what's the peak power, and does it really matter? Because for a picosecond device, you don't need high fluence. You just want to hit it so fast that it doesn't cause any kind of photothermal damage. It's causing a photomechanical damage. So it's hitting it so fast it creates LIOB, laser-induced optic breakdown. So typically that's anywhere from 0.2 joules to maybe 1.2 maximum. So we're not doing a whole lot. And if you look at these patients that were shared with us, these are pretty nice changes. And again, you can go to fractionated Pico and get rid of some of these individual lesions, like if they're macular seborrheic keratoses, lentiginous, on all skin types. So it's incredibly safe.
This is a procedure that I've been... This is the procedure that I've been using in the practice a lot this summer, only because, it's summertime here in Dallas. And so it has allowed me to continue doing some rejuvenation for our patients without actually slowing them down, because it is that photoacoustic. So great to just kind of year round with them as well, too.
And for melasma. So melasmas are unfortunate. It's such a horrible condition to have to treat. But through the summertime, I tell patients now, come in for your Pico. We're going to combine the Pico. I actually use a light chemical peel on top. It's from PCA Skin. It's called Pigment Correct Peel. So super safe to use. I run my Pico or my handPICO over this area. I'm using, again, super low fluence. So typically about 0.6, 0.5 joules. And then I can paint over this entire area. Use a single 1 to 2 passes, sometimes 3. You just want to make sure you don't get too much heat. And then I put a single pass of the Pigment Correct Peel, and we're getting great results. If you go over the individual lesions, like on this far upper left, those are seborrheic keratoses that are on the chest. Look, you're able to clear these with that hypopigmentation that you oftentimes get with the liquid nitrogen. So when a dermatologist tells me, well, I've got liquid nitrogen, I can do all that. You can. It's not that you can't. And I'm not saying you're not skilled, but if I can do this with minimal to zero risk, and there's never zero risk, but minimal risk of causing hypopigmentation, I'm all in. Hyperpigmentation we can fix. Hypopigmentation is incredibly hard to fix. Any comments on these, Dr. Eubanks?
No, but everything you said is so true, because I believe that Pico handpieces is primarily for resurfacing and for pigment, and not, it's nice if you want to do tattoos, but most of the aesthetic dermatologists are not that interested in tattoos. Occasionally it's nice to have this, but it's a resurfacing pigment tool that's incredibly effective.
And so I'm glad that you brought that up, because I kept feeling like I was the minority in not wanting to treat tattoos. And in my last 24, almost 25 years now, when a person comes in with tattoo regret, yes, they'll start the treatments with you, but oftentimes they're like, well, it's not moving away fast enough. And so that's been hard for me. So this is oh, by the way, can you also treat this tattoo? Or I've done 10 treatments. Is there anything else you can do? With this, I'll often treat for resistant tattoos. I think it's in the next picture. Let me see. No, I don't have it. Is there a picture of a tattoo? No, I apologize. I thought I had a picture of a tattoo. It's an old tattoo. She'd already had 12 treatment sessions. So I combined the ProDeep. So I broke up some of the scar tissue, and then I used a nanosecond and a picosecond on top of it, all in one treatment session. And we got a ton of clearance in a single treatment session for something that she had given up on. So this was in the groin area. In terms of these the suite of lasers, the IPL, what's so unique about the IPL that they have, it is a continuous wave motion, so you can do really nice changes. We talked about the ProDeep, we talked about the handPICO. Are you utilizing this Achroma QS?
I do unfortunately get to treat a few tattoos, and I think a Chroma QS is a great tattoo, because I also have a standalone Q switched quantum machine that's also very good.
Nice too.
But this thing is so fast, so easy. I think not having a big articulated arm makes all the difference in the world. And we talked about dual mode. I've also started using a long pulse for leg veins. I have a Candela G-Max Pro that does long pulse and YAG, but this thing, again, it's just an add-on. I just use, I tend not to use this that much because I have a great need for it. But the 515 LT would be the one that's 5 meters to 15 millimeters that I would use. I use that one primarily.
And the 310, if you're using something like a light laser toning, it does improve erythema, so you can use it similar to how an Aerolase works, but your hertz is so much faster. You can treat a full face in about 5 to 7 minutes. So we're going to pause now for questions. I'm going to go to the next slide just to give you an idea. You can always scan this. This goes directly to my, it DMs me on Instagram, so I can answer any questions. Dr. Eubanks, do you want to share your information as well?
I'm not sure how to share that, but
if you tell the audience,
you can just you can do my work email, which it's a long one. It's it's Dr. S. Eubanks, so DRS and then EUBAS, and then it's at ADCSclinics.com, and ADCS is my company, the Advanced Dermatology.
And we'll type it into
send that to anyone who needs it.
Yeah, please. Vydence. And if you reach out to your local reps, they're going to be able to share both our contact information. Yes. One of the questions that I see here is from Dr. Tony. When you do hair restoration with the ND app, are you mixing with exosomes, PRP, et cetera? If so, do you have thoughts on what part of this combination therapy is actually doing the work? This is the first time I'm talking about energy-based hair restoration. This seems interesting. So, Dr. Eubanks, do you want to take that, and then I can answer after you?
The protocol, we're going to do a dual protocol study, and one is just nothing but ProDeep by itself with no other treatment, because the Brazilian doctors feel that you get moderately good results with just the laser itself, but the combine it with exosomes. And what we're going to do, it's going to be a 5-session treatment, about a month apart. So it takes a while. First treatment, ProDeep. Second time you come in, we do injectable exosomes. Then the next 3 treatments we'll do ProDeep again. That'll be our protocol.
I love it. And Dr. V, one of the things I'm looking at is right now I'm using a multi-step protocol, because in real life, if I can get better results with fewer treatment sessions, the patient is going to trust in what I do. So my protocol right now with the 5 pilot study patients, that's a prospective study. I just want to, and we're doing trichoscopy to see what the hair count is. I'm using, I start them on Viviscal Pro. I want them to be on that for about a month before I actually start the ProDeep. So that way it kind of preps that area. We're optimizing nutrients. On the same day that they pick up the Viviscal, I'm actually putting them under this pulsed wave LED light. It's I think it's a 630 nanometer LED red light. So I know by doing that for 20 minutes and then bringing them back at 2 weeks later, doing that again, it's decreasing the inflammatory component, but it's also improving the baseline vascularity. And then I bring them back at the 1 month mark. I start this protocol now. I use the ProDeep single pass with the little hair spacer, the hair lens on there. I apply topical exosomes. I'm using the Benev ERC Plus. Why that versus one of the other 11 companies that's out there? It's the only one that's actually shown research. And so it's actually been published doing a split scalp study as well. Immediately after in that same session, I then apply the LED. Again, it's a pulsed wave LED. It's called Smart Lux. And now I only do it for 10 minutes. In between the next session, which is going to be 1 month later at the 2-week mark, so halfway in between that time frame, I'm going to do another 20 minutes of the LED. So that's what we're doing right now. If this works well, then we can go back and we can compare this with Dr. Eubanks' study where he's just treating with the ProDeep, or I may just do a split scalp. I'm going to split it by 4 centimeters on either side. So probably just the temples, and we can adjust for that, doing ProDeep by itself on one side, ProDeep plus exosomes on the other side. I stopped using PRP. This has been now 2 full years. I started using topical exosomes about 3 years ago, and we're seeing great results without having to inject anything. There's no pain. I don't have to worry about the platelet accuracy. And what I mean by that is when we did a retrospective look at 10,000 treatments that we did with PRP. Our success rate over 10,000 treatments was 89%. And 89%, you're like, that's pretty good. Yeah, it's okay, but why did the other 11%, why did they fail? That's what my biggest question was. And so I got 2 medical students to help me. We call back every single one of the patients. And what you discovered, if you ask the right questions, most times that person had either had alcohol within the last week, they had had some type of anti-inflammatory, even though they forgot about it because they track when they're getting aches and pains. And so we think there's something else to it. The other thing that I can't predict with platelets is a 70-year-old person's platelets going to be as healthy as a 30-year-old's platelets. I don't know that answer. So I'm trying to remove as many of the patient variables as I can and have something that's off the shelf.
That's a great approach.
Dr. Eubanks, I'm going to read a question to you. This is an anonymous attendee. I'm not sure what you're scared about, but I'm okay with it. Are there any concerns for doing a laser treatment for a burn scar on the chest over the heart?
Absolutely not. The science there is absolute, that the depth of penetration of that laser is so superficial. It's less than a millimeter or around a millimeter. It's not, there's no risk whatsoever, and that also goes with patients with pacemakers and stents and things like that, where radio frequency might not be something I would think to use, but you can absolutely do ProDeep.
Yes. And so I love that answer. And so I'm glad that you asked that particular question, because my father just had a pacemaker put in 2 weeks ago. It'll be 3 weeks this Friday, so 2.5 weeks ago. And I asked the EPP, the electrophysiologist, the cardiologist, I said, hey, listen, I have another patient who's she's 16 and she had to have a pacemaker put in. It's the sister of one of our aestheticians. And I said, would it be safe to use a laser to help with the scarring on this young lady and maybe my father in the future? And he goes, well, how deep does the laser go? I said, I can adjust it between 200 microns and I can go as deep as 1,200 microns, at least theoretically. And he goes, oh, no. This is, centimeters inside the skin. So there should be no concern there. But
the difference between for instance, radio frequency, though, is RF will actually pass through the patients and go at 2 centimeters. So that's why I avoid that with.
I agree with you
completely.
I agree with you 100%, especially if you're using the body as part of the polarity, the grounding plate. What else? What other questions? What do you see over there, Dr. Linda?
I don't have another question, and I think we're right at 1 minute left on our call. So I just wanted to take this time. Thank you both for being on the call with us today. I think we had some really good headway and lots of great questions. If everybody has more questions for these two gentlemen, you can always go to lasers.vydence.com and send us some questions here, and we can always direct you to Dr. Eubanks and then also Dr. Suneel Chilukuri. So I appreciate you spending your afternoon with me, And with Vydence at Laser Talks, we will get you a new date for our August Laser Talks and send out an invite for that as well. So we appreciate everything. Make sure to follow us at Vydence.com as well, too.
Linda, I'm going to interrupt you for 1 second.
Yeah.
Dr. Mauricio, thank you for joining us. So Tess Mauricio, if you don't know her, she treats the stars. And so she wrote on here, loving my Vydence laser, getting amazing results, and the treatments are so fast and easy. I actually have fun doing the treatments. So that's very kind of you to say. And it's always nice to get the attendance of a superstar like you. So we appreciate you.
Yes. Thank you for taking your time.
Yes. All right. Thank you, guys. Thank you for everyone coming.
Thanks. Bye-bye.
Thank you. Good night. Bye-bye.